The name of this exercise is called the foam roll lat rollout. The purpose of this exercise is to loosen up and relieve the trigger points of the latissimus muscle, which travels all along through here. Loosening these muscles up and making this more flexible will help improve shoulder and thoracic spine mobility, and it will help improve performance during any type of upper extremity activity, including racket sports or throwing sports or weightlifting. For the lat rolling exercise, we're going to be loosening up and working out her latissimus muscle. We're going to use the foam roll. She's going to roll over it and hit her middle fibers. She's going to rock and get her posterior fibers through here, and even get her anterior fibers through the lat. So to get on the foam roll, she's going to lay down and get the foam roll way up in her armpit. Once the foam roll is all the way up in her armpit, she'll rock up and down on the foam roll. This lat muscle comes all the way from her shoulder all the way down to her hip. So she's going to come about halfway up her thoracic spine and then all the way back out into her armpit. As she finds trigger points along that area, she'll stop and she can work slowly and oscillate up and down over that area. She can even rock back and forth to work that trigger point in a different plane of motion. And she may even find it's more intense being in this rolled back position, so she can rock up and down in this position. Or she may find as she rolls forward, there's a more intense trigger point on the front side, so she'll go ahead and rock up and down in this position. She can add a variety to this stretch by bending her elbow, resting it on the ground, and rocking it into internal and external rotation, and even creating a counter movement with her body until she finds the best way to release that trigger point. And then she may decide to roll back up the foam roll, find a new trigger point, and roll forward and backward again. She'll do this for about 2 minutes to work out the entire lat muscle.